surge. But as I said, if you are experiencing these kind of surges, vaccines won't be fast enough. Got to add on the additional measures.
Thank you, Dr. Tam. I also wanted to ask you on the topic of vaccines. Moderna reported yesterday that they believe a booster may be warranted because their data suggests immunity 13 months after 2 shots is lower than after, 13 months is lower than after 8 months. So how does that data affect how you are thinking about boosters and potentially rolling that out in the months to come?
Well, that's one of the most important questions we're trying to answer through the National Advisory Committee on Immunization in looking at the international data, but also in looking at the domestic data as well on vaccine effectiveness. So we are waiting for, of course, data to be provided by the manufacturers to Health Canada and to be examined by NACI. But last week, there was, of course, recommendations on additional doses. These are not boosters, but additional doses to increase the protection for those who are immunosuppressed. The next priority is to look at whether boosters are needed for the highest risk groups, the seniors in long-term care facilities. But we've got to be really thoughtful and undertake a thorough analysis of all of these different types of data, as you've mentioned, from manufacturers, but also from public health systems, in order to take a thoughtful approach to boosters for the general population. But I do think that the initial focus would be on the high risk. We have been using different vaccines. Different vaccines might have different levels of protection that might change over time. Bottom line, though, is you got to also look at vaccines effectiveness against what. And so far, vaccine effectiveness against serious outcomes are very high. But we need to unpack the data to look at each vaccine as well as the programs overall. But we should be coming back to communicate the NACI the deliberations and recommendations in the weeks to come.
Thank
At
you,
the moment,
Dr.
just to round up my response, it is very much more important to get those who haven't even received a single shot to get their vaccines. While, of course, boosters are being examined, but getting those unvaccinated groups vaccinated is what's going to really make a difference to our current COVID experience.
Thank you, Dr. Tam. Laura, if you have a third question, we'll allow it today. Pardon, can you say that again? If you have another question for the doctors, we'll allow one more question. Sorry, I think just on Alberta once again, a lot of people are frustrated there that they got to this situation in the first place, given that public health measures were lifted over the summer. What lessons do you want political and health leaders to learn from this?
Yeah, we're always learning through this pandemic, and navigating through the next months is not going to be an easy thing. One of the equations that one needs to understand is that if measures are let go of too quickly and vaccination rates are not going up fast enough, you're going to get into a situation where this virus, the Delta virus, is very contagious. And so you're giving room for this virus to accelerate if your vaccine coverage isn't moving up faster than your reopening or easing measures. So that's really critical. And the fact that even though we are very much in a much stronger position with a huge majority of the of Canadians already getting their first shot and then second shots, we still have close to 7 million people unvaccinated. which leaves a lot of room for this virus to accelerate, and that when it does accelerate in the population, you are going to see the hospitalizations and ICU admissions. When enough people are infected, even rarer events in younger adults, for example, even rarer events are going to become common. So we are seeing, and I think there's some really amazing coverage by the media of the ICUs being filled up with younger people. These are not seniors. These are people who are definitely under 60, and the people in their 40s and their 50s, sometimes younger, filling up the ICUs. COVID is not a mild illness by any stretch, even in some of the younger populations. So those are really important facts to know about this virus. And but we know what to do to keep things under control. If we want to keep schools open, for example, we have to make sure we manage the virus transmission outside of that setting, and to protect the kids who are under 12 who can't get vaccinated at the moment. I know that my colleagues are pulling out all stops to try and keep schools open, and many layers of protections have to be applied to try and keep those very essential spaces continuing, I think, over the next months. But don't be complacent. We've got to be highly vigilant on this virus. When you see it accelerating, act fast, because I think we got to learn from the situation in Alberta and also in Saskatchewan at the moment, in the west of Canada. It's not just Alberta. So this is a widespread experience for a good part of Canada.
Thank you, Dr. Tam. Next question. Prochaine question.
Thank you. Merci. The next question is from Peter Simonjek from CBC News. Please go ahead.
Thank you. Can you hear me, Dr. Tam?
Yes.
Great. Thank you for doing this. You touched on there a second ago on Saskatchewan. I know that you guys pay close attention to how this virus is spreading itself around the country. There were lots of indications in the lead up to Alberta this might happen. Where else are the hotspots in the country? What's next? What's after that? What are the places that you think need to start taking actions now to avoid falling into Alberta's fate?
Yes, so the highest rates are being observed in provinces in the West. We've also taken quite an interesting analysis, which is to get down to the sort of local health unit level on vaccine coverage. And there's a pretty good correlation between areas with low vaccine coverage and where this virus is going to surge. So that's a pretty good indicator where you don't have high vaccine coverage. You've got to be highly vigilant, and you may have to apply some additional public health measures if you can't get your vaccination rates up high enough. So some of these areas are in northern Saskatchewan, in Alberta, in parts of other provinces as well. And provinces do know those rates, and so that this is a signal. Learn from the West, and know that this could happen anywhere where vaccine coverage is low. I think is probably one of the key ways of looking at how to prevent what's going on. And I do know that people are doing all sorts of approaches to minimize risk. So one thing is that when your rates are not very high, you can apply local measures if you see cases rising to halt the spread quickly, so that you don't have to have province-wide requirements, for example. The other thing is that the simpler things, the lighter measures such as masking indoors. I've seen some other jurisdictions reintroducing masking in indoor spaces, reducing those contacts, gathering sizes, etc. And we're monitoring, of course, the effectiveness of the vaccine requirements, and all of those things will help. And but it's probably easy enough to predict the hotspots given the vaccine coverage levels.
Okay, just as a quick follow-up, when you're talking about the West, are you just talking about Alberta and Saskatchewan? Because those are the only two ones you mentioned, or are there other pockets or provinces out there that you're concerned about? And just off the back of wanting to increase the vaccination, I get that. It seems like in some provinces, in some areas of the country, increasing the vaccination rate is a very slow-moving process. Is it just masking and looking at numbers, or are we talking about potentially recommending further lockdowns to stop the spread of this virus before it hits what's happening in Alberta today?
Yes, and as I said, we are in a stronger position than before given the vaccines. So I think the objective is to have more circumscribed, localized restrictions if needed. So I think jurisdictions do have to be prepared for that potential. But if you act early, you can actually avoid those more restrictive measures. So that's where the masking, the spacing, the preventive measures like the personal hygienic measures don't go into gatherings if you're sick, and don't go to work. Getting your ventilation system examined and improved and enhanced, all of those things can help reduce those risks prior to any need for more restrictive measures. But if needed, more restrictions may have to take place. And my colleagues are hoping that this can be done in a more localized manner, and in order to avoid the significant impacts of widespread restrictions. I think it can be done, and we'll see. And I think any of the big 6 provinces could experience a resurgence. There are different areas locally, even Ontario or Quebec, but some of the provinces like Alberta and Saskatchewan is much more widespread in terms of viral activity. BC, you've seen interior health, and maybe some of the other northern areas, but it is a bit different across the country. But no one is sort of immune from a highly transmissible virus. Even the provinces to the east have experienced some blips, but they've acted pretty fast in putting down some localized measures. And so I think they're hoping to keep activities low and avoid the more restrictive measures.
Thank you, Dr. Tam. Next question. Prochaine question.
Thank you. Merci. The next question is from Christine Barak from CBC News. Please go ahead.
Hi there. Thanks for taking our questions. Just going back to boosters, I know you mentioned that there is advice that you're getting from manufacturers. We've been hearing about Israel's experience. Now we're seeing data from Pfizer and Moderna. Are you more interested in the measured antibody levels in that data or the severe illness outcomes?
Thank you for that question. Yes, I mean, we're interested in beyond the antibody data, and we're trying to gather that from different studies on the ground on vaccine effectiveness. So antibody levels might go down over time. That's actually expected. And to what extent, we're going to look at in the data. But it is actually really important to gather some actual vaccine effectiveness measurements on the ground in the context of Canada. Different countries implemented their vaccine programs slightly differently, with different vaccines, with different intervals between the first and second dose in different populations. So it's not a simple analysis, but it is one that should be done before we move to general population boosters. Safety, of course, that data is important. You're adding additional doses. And so far, some of the other experiences in other countries shows that that additional dose seems to be safe and not too dissimilar to the reactions seen after the second dose, but we have to, that's obviously very important. You also have to think longer term. Obviously, the virus is undergoing evolution. Is this the right timing? When is the right timing? What's the interval between the second and third dose if we go there? So it's definitely not just antibody levels. We will be gathering the data from across the country. We're actually gathering it as we speak on the vaccine effectiveness over time in different populations in the community.
And just as a second question, is there a tipping point that's quantifiable? So if you're looking at this data, is there something specific that would tip the balance in favor of boosters?
Well, I think looking at protecting the high-risk population is very key. You asked whether we do have to unpack the vaccine effectiveness data on, is it vaccine effectiveness against infection, any infection, vaccine effectiveness against illness, so symptomatic infection, or vaccine effectiveness against hospitalizations and deaths. And so right now, the vaccine effectiveness, for example, for the mRNA vaccines against hospitalizations and death seems to still be very good many months after the initial 2 doses. So I do think that what you want to see is a high level of vaccine effectiveness against severe outcomes for sure. So any kind of waning trend on that front is very important. We are discussing then, well, what are the other objectives? Should we be preventing milder illnesses? Would a booster's dose prevent further transmission and more community protection? So those are still questions that we're trying to analyze at the moment.
Thank you, Dr. Tam. Any more questions, operator?
Thank you. Merci. Once again, please press star 1 if you have questions. De nouveau, n'hésitez pas à appuyer sur étoile 1 pour toute question. There are no further questions registered at this time. Nous n'avons plus de questions pour le moment. I would now like to turn the meeting back over to you. J'aimerais vous retourner la parole.
Merci beaucoup. That will be all for today's
Thank you very much.
technical briefing press conference. C'est ce qui met fin à la conférence d'aujourd'hui. Any additional questions?
We were listening here to an update on COVID-19 across the country from the Public Health Agency of Canada, and you can see on your screen there the Chief Public Health Officer for Canada, Theresa Tam, taking questions from reporters, specifically in many cases about what provinces could have done, read Alberta, read Saskatchewan, to stop the surge in COVID cases